It's never been more important than it is at the moment to hang on to your private health insurance. As many of you know, some common elective surgery procedures like hip and knee replacements and lens replacements for cataract surgery were postponed earlier this year due to the pandemic lockdowns. This means that there's a huge backlog of elective surgery to catch up in the public system, and we're expecting that in the public sector, wait times for many of these common procedures will be more than 1.5 years from next year and beyond. Private health insurance gives you peace of mind so that you can get access to elective surgery when you need it, and also access to a specialist doctor who will be your point of contact throughout the procedure. Health funds are also covering telehealth services for a number of allied health services in the community, including mental health services, some physiotherapy, speech pathology, dietetics, and many others. If you are under financial stress as a result of the COVID-19 pandemic, please contact your health fund to discuss your options before considering dropping your cover. It's never been more important to hang on to it.